In an instant, life can change. A workplace accident, a fall, an assault, and suddenly an iron bar, a spear, or any sharp object becomes embedded in someone's body. It's a scene straight out of a nightmare, but it's a reality that emergency services deal with, and one where, as we'll see, there is a protocol that can make the difference between life and death. Today, we're going to talk about that protocol. We're going to break it down step by step, based on medical evidence and pre-hospital care procedures, explaining what you should and should not do when a person has an object piercing their body. The first rule, the most important one, the one that should be your mantra from the very first second is, do not remove the object. This is the golden rule we're starting with today. Removing it can turn a serious but manageable injury into a massive and unstoppable hemorrhage. Before even touching the victim, we must prioritize our safety and theirs. We can't help if we also get hurt. The International Protocol for Trauma Management, known as XABCDE, tells us that the first thing is the X, which stands for exsanguination or massive hemorrhage. But before that, assess the scene. Is there a risk of electrocution? Is the object in an unstable place? Is there a danger of collapse? If so, move the victim only if it is absolutely safe and without moving the object. Once safe, the next step is to control a massive hemorrhage if there is one. But in an impalement, the bar itself may be containing the bleeding, acting as a plug. Do not remove it. Now we move to the primary assessment, the ABCDE sequence that every emergency professional follows. A is for airway. Can the person speak? Is their airway clear? If the object is in the neck or face, the risk of obstruction is extremely high. Do not move the head to open the airway if there is a risk of cervical injury. Use the jaw thrust technique if necessary, but without moving the neck. B is for breathing. Is the person breathing? If the object has pierced the chest, there may be a pneumothorax, which is air entering the pleural space. Listen for a hissing or bubbling sound of air escaping from the wound. This is a life-threatening emergency. C is for circulation. Control the bleeding. If there is profuse bleeding around the object, apply direct pressure around the wound, never on the object, using gauze or clean cloths. D is for disability. Assess neurological status. Are they conscious? Are they speaking coherently? The Glasgow Coma Scale should be used to check for associated brain damage. E is for exposure. Expose the victim to check for other injuries, but be careful not to cool them down, as hypovolemic shock from blood loss lowers body temperature. This process must be quick and efficient. While one team applies pressure, another assesses breathing and consciousness. Now let's talk about what to do with the object itself. The object is now part of the victim. Any movement of it, however slight, can tear more tissue, sever arteries, or damage vital organs. If it's very long, it can be cut, but with extreme care. You must hold it firmly with one hand while cutting with the other to avoid vibrations or movement. Ideally, enough should protrude to immobilize it, about 6 to 8 inches. Once shortened, the object must be immobilized exactly where it is. This can be done with bandages, tape, or any material that holds it firmly against the body, like a splint. The idea is that the object and the body form a single block that won't move during transport. Next, dress the wound. Place gauze or clean cloths around the object to absorb blood and protect the wound from contamination. Do not attempt to reposition any protruding viscera. If there is exposed tissue, cover it with a sterile dressing, moistened with saline solution or clean water to keep it moist and prevent it from drying out and being damaged. Never try to push it back inside. Then we manage shock and positioning. The body is in a state of alarm. Blood loss and pain can cause shock that can be fatal. Lay the victim down. The safest position is usually flat on their back, as long as it doesn't interfere with breathing and the airway can be maintained. Elevate the legs slightly if there is no suspicion of spinal or pelvic injury to help blood flow to the brain. Keep them warm. Cover them with a thermal blanket or clothing to prevent hypothermia. Reassure the person. Panic increases oxygen consumption and worsens the situation. Speak to them calmly, ask them questions to keep them awake and alert. Now we arrive at the most critical part, what not to do. Sometimes what we don't do is more important than what we do. Number 1, never remove the object. I repeat this because it's crucial. By removing it, you lose the plug effect it exerts on damaged blood vessels. The resulting hemorrhage can be impossible to control in a pre-hospital setting. Number 2, do not push the object. If it's in the chest or abdomen, pushing it could damage more organs. The trajectory it has already caused the damage. Don't move it inward or outward. Number 3, do not explore the wound with your fingers. Don't put your fingers into the wound to feel the depth. You could introduce bacteria or dislodge a clot that is stopping bleeding. Number 4, do not remove small objects or fragments. If there are small fragments, do not try to extract them. This will only cause more bleeding and tissue damage. Number 5, do not give the victim anything to eat or drink. They will likely need emergency surgery. General anesthesia requires an empty stomach to prevent vomiting and aspiration into the lungs. Number 6, do not move the victim unless absolutely necessary. Moving them could cause the object to shift and cause additional damage. Immobilize the object, place the person in the most stable position, and wait for emergency services to perform the transport with the appropriate means. The general protocol changes depending on where the object is embedded. In the case of an impalement in the chest, the priority is to seal the wound to prevent a pneumothorax. If the object is in the chest and you hear air entering, you must cover the wound around the object with an occlusive dressing like plastic or a piece of rubber to create a seal that prevents air from entering, while allowing the air already inside to escape. In the case of an impalement in the neck, zones 2 and 3, this is the most critical scenario due to the number of vital structures: carotid arteries, jugular veins, trachea, and spinal cord. Here, airway control comes first. If the person is not breathing, advanced procedures like a cricothyroidotomy must be considered, but this is something only trained medical personnel should do. Cervical immobilization is paramount. Direct pressure to control bleeding is even more delicate, as it can compromise cerebral blood flow. In the case of an impalement in the abdomen, the risk of peritonitis and damage to organs like the liver or spleen, which bleed profusely, is extremely high. If viscera are visible, cover them with moist, sterile gauze and do not attempt to reposition them. Any manipulation is dangerous. Finally, we prepare for transport. When emergency services arrive or if you call for help, clearly describe the situation. There is a metal object of such size penetrating the victim's chest, neck, or abdomen. It has not been removed. It is immobilized. Bleeding is moderate or heavy. Paramedics will place a cervical collar and a spinal board to ensure the person does not move an inch during the journey. This is essential to prevent further damage. Remember, the goal of first aid is not to cure, but to stabilize the person so they can be transported to a hospital where a surgical team can perform the appropriate procedure, removing the object under controlled conditions and repairing the internal damage. And that brings us to the end of this intense but necessary journey. We've seen that, although such a situation would send chills down anyone's spine, having a clear protocol can be the real lifesaver. It's not about being heroes, but about being informed people who, in a critical moment, know how to act without putting the victim's life at further risk. Always remember, stay calm, do not remove the object, apply pressure around the wound, immobilize, and call emergency services. They are simple steps, but they carry enormous weight. If you found this content useful, if it sparked your curiosity, or if you simply liked how we approached it, don't forget to give it a like, share it with someone who might need it, and subscribe so you don't miss our upcoming videos. In the next episode, we'll continue exploring extreme cases and how medicine and quick action can work true miracles. As always, take good care of yourself, stay calm, and above all, never stop learning. See you in the next video.